I'm Dr. Abhijeet Lonari, Joint Replacement Surgeon, Aditya Birla Hospital. Today I'll talk about the knee replacement surgery, the actual surgery. Now we all know this is very successful surgery and is done very routinely. But many of my patients still don't understand what the surgery exactly is. So today I just briefly describe you the surgery. Now we all know this is our normal knee. So the bony ends are covered with a soft cushion which is known as cartilage. Now arthritis is the erosion of this cartilage. The cartilage gets distracted, the bony end gets open and start creating the pain. This is the arthritis. So what we do in knee replacement, we just cut the slice of the damaged portion of the bone and cartilage and it is replaced by the metal. This is knee replacement surgery. Now how exactly it is done? So when we start the surgery, we cut the soft tissue, take the patella out, dislocate the knee, expose the bony ends. So this bone is known as femur. We take 5 cuts. All cuts are taken to accommodate this implant precisely. This is the tibial bone. We cut it at 90 degrees. Once we are done with the cuts, then we take the final implant. And this is the femoral component. Now we put cement here and it is fixed to the bone with the help of cement. Same, we take the tibia, we put cement here and it is fixed to the bone with the help of cement. The third portion is the polyethylene, which is the articulating part. We put the poly here and we locate the joint. So now you all can see a new joint is formed between the metal and the poly, and which is well balanced throughout the range. Once it is done, we replace the cap back and suture the wound. So my success of surgery depends how well aligned I put the new joint, how precisely I align it to the mechanical axis, and how well balanced is the joint throughout the range of motion. This gives the long-lasting effect of the arthroplasty. Thank you.